You think your patient's having hemodynamic compromise, but you don't have invasive monitoring. What are you going to do? My name is Leah. I've been a CVICU nurse for 18 years, and today we're chatting through how to assess patients who don't have invasive monitoring if you believe that they're having some issues with hemodynamics. Remember, we talked in previous videos that hemodynamics is just how blood flows through the body. The heart's the pump, it flows through the body, and that's all hemodynamics is. Big scary word, but it's really not as scary as it seems. So today we're going to talk a little bit about some ways that you can still assess your patient without having a Swan-Ganz monitor or a PA cath of any kind. If you have a patient that's not doing well hemodynamically, you're going to see a decrease in their blood pressure and their MAP. We prefer MAP in an ICU setting because a MAP is going to be how the patient's doing over the entire cardiac cycle. I know we've all worked in places, if you've been in ICU for a long time, where we can never get the patient's MAP where it needs to go. At some point, a physician says, especially for our patients that are already at kidney failure, I'm not even worried about that MAP, just try to keep their systolic over 90. So that definitely happens, but best practice is to use a MAP and try to keep it over 65. We will also, if our patient is starting to decline hemodynamically, see a big difference in our patient's pulse pressure. All a patient's pulse pressure is the difference between their systolic blood pressure and their diastolic blood pressure. So all of these are non-invasive type of monitorings that we'll see changes in when our patient is starting to have hemodynamic problems. So if you start seeing these changes in your patient, as well as watch the last video we put up where we talked about the physical assessment changes we can see. So if you see these changes, make sure you're communicating with your provider to make sure that they know that your patient is starting to have hemodynamic compromise. Continue to follow this video series and we'll continue to talk about all things hemodynamics.